Tell me what your top 3 things are, lifestyle-wise. If someone's sitting here today and say, look, I'm worried about my dementia risk, what would you be telling them, your top 3 things to change in their lifestyle?
Okay, so the Lancet Commission has done this and they've got 12 things that you can do.
Okay.
But they also have hearing loss on there and chicken and egg. So I told you if you don't use it, you lose it.
Yeah.
And if you're not hearing conversations, you tend to be a bit out of conversations. And then, so I don't know whether that's a risk factor or associated or even an early symptom.
But do hearing aids not protect you from dementia if you've got
So
hearing
you'd
loss?
need to have a randomised control trial where
And
you
there's
go
not been one.
Well, you can't say to someone, I'm going to let you not hear
Of course,
and randomise
of
double-blind.
course.
That's awful. This is what I
course.
mean. When you're dealing with complexity, we
Yeah.
have to move away from that level A evidence model.
Yeah.
And anything lifestyle is not randomised.
Yeah.
I'm going to make you exercise and I won't, and neither one of us will know what we're doing. Yes, we will.
Yeah.
It's very complex. And aging is complex. It's all about multimorbidity.
Absolutely.
So if we want to crack the nut of healthy aging, we have to change this model of complete control because humans can't be controlled.
Yes.
I mean, some of the jokes in medicine are that in the trials, they have full compliance with the medications. And all the studies done 100,000 times, there's not compliance, not near 100% compliance. It's about 70% compliance with medications if you look at an individual. So, they're still working at 70% compliance. It's pretty good.
Yeah. So tell me the top 3 things.
Top 3 things. Oh, yeah, 100%. Okay, so I'm going to do this for women because you can look up the Lancet Commission if you want for everyone.
We want women.
So this is for women and it's very different actually.
Okay.
So the number 1 thing is the same for both men and women. And it's physical activity.
Okay.
It's the number 1 thing to do. Don't freak out. You don't have to go to the gym. An hour of activity every day. Pick something you love because you've got to do it every day for 40 years. And then you won't get dementia, so you'll still be alive. You've got to do it for 50 years.
Now, whenever anyone talks about exercise and physical activity on the internet or social media, it's always about, getting your VO2 max up. It's about doing the portfolio. Yeah. So what are we talking about?
So it's any activity that you would like to do for 1 hour a day, every day.
Okay. We don't need to think about what our heart rate's doing. We just need to just do it.
You just got to do it for 1 hour every day.
Okay.
Now I can give more detailed advice, which is yes, you got to do. You'd like to, in that 1 hour, you want to get your VO2 max up, but that's just one tiny aspect.
Okay.
You've got to do resistance training. You've got to do balance. People never, and that's far more, and people are dying of falling over far more than they're dying of VO2. In fact, sometimes VO2 max ends up as cardiac arrest.
Yes.
So, in a funny way.
Yes.
So there's all sorts of different exercises we should be doing to be optimum.
Yes.
But balance is right up there, and resistance training to get out of a chair literally is way more, ask anyone old, that's way more important to maintain your balance and your ability to get out of a chair than anything else. Getting out of a chair predicts your death.
Yes.
So that's really important. It's number 1. It's for everyone. Number 2, for women, is to have good blood pressure.
Yes.
Women and blood pressure. Blood pressure is a silent killer of most women. Here in Singapore, your leading cause of death is heart disease. Your highest rates of risk factors. You have smoking here. Who's smoking? We don't smoke here.
Oh, yeah.
In Australia, we go, hell, people, it's like
do.
smoking? What?
Yes.
And high blood pressure. So, we've really got to look at our high blood pressure. The other problem, it's not a problem with women. I was just about to say the other problem. Oh, my God. The other problem is that when men have a high blood pressure, it'll be a high blood pressure and it stays.
Yes.
Women have what we call hypertensive variability. So it'll go, whoa, whoa, whoa. And it'll always be high.
Yes.
But it can go really high.
Yes.
So sometimes you'll be in the office and the doctor calms you down, and because he takes it as too high. Oh, okay, you better calm down. And you can calm it down.
Yes. And they go, oh, it's white coat.
Yeah. Oh, that's okay. Oh, we might just watch it. But actually those women are hypertensive.
Yes.
Most of the time.
But will that be picked up if they did a 24-hour blood pressure monitor?
Yes, it will. And everyone should have one of those.
They
I
should.
highly recommend for women.
Absolutely.
So it's your hypertension, and get that 24-hour monitor.
Okay.
Even if they say it's borderline, because we've got great treatments for high blood pressure, and they
really
actually, thank God, work in women as well as men.
Absolutely. Okay.
And then the third one is when they talk to you about your lipid profile and watching your cholesterol and LDL like a hawk, watch your HDL.
Yes.
Women must have over 1 high density lipoprotein. You've got to have that, and then you're going to be protected. Those are the top three. And, cholesterol and LDL do matter for women, but when we did our studies, the cholesterol and the LDL are, of course, directly correlated with the HDL.
Yes.
So they do matter, but actually it's the HDL driving the relationship. They're just biomarkers because they're related to the HDL. So it's your HDL that's actually causing disease in women when it's not high enough.
Understood.
That's our good cholesterol. We got to get it up there. One of the issues is they're not making tablets for it because it wasn't a male thing, and that's where all the heart disease kind of came from. But one, they're starting now, and two, the way to get up your HDL, would you believe, physical activity.
Oh.
So I actually wonder, I told you for men, physical activity is number 1, 2. I wonder if I told you 20% microvascular, that's them getting their HDLs up.
Understood. That's really good advice. Okay, so we've got the things that you definitely would do. Can I just give you do a quick fire round on a few other things that are very popular in social media at the moment, and tell me what you think.
Oh no, I'm not talking about Trump. I absolutely refuse.
No, that we don't need to go down there. But okay, creatine supplementation, yes or no?
Okay, so any of the supplements have not been proven because you need 30 years data.
Yes.
And some of the ones that they say don't work, they did a 3-month follow-up study or they literally do 3 months of supplementation, expect to see a change. This is a disease that takes 30 years. So a lot of those questions are difficult. Also, we know vitamin D supplementation with calcium works great for bones. Turns out, so people who have low vitamin D are more likely to get MS.
Yeah.
People who have low vitamin D more likely to get dementia.
Right.
And we showed in our study they even have worse cognition, which was horrifyingly shocking.
Wow. Vitamin D is just so important for everything, isn't it? Yeah.
But all the supplementary studies haven't shown any benefit.
Okay.
And that kind of freaked us out because, but they're short and so on. But then again, we see even drops in vitamin D will drop cognition. So it really should have helped. And then we are now realizing vitamin D is not something we eat. I mean, I know you can get tablets, but in human beings, we actually get it from sun exposure. There is a compound in our skin. When the sun hits it, it converts into active vitamin D. Our body sucks it up. You can eat vitamin D. It's in eggs. It's in things, but that's not where we're meant to get it from. We're meant to get it from the sun.
Totally.
Now, it turns out that reaction in our skin is an anti-inflammatory reaction.
Right.
And we're all, in Australia, we do not want to get skin cancer.
No.
And sunscreen blocks the vitamin D conversion. So everyone's out of the sun. People are now working from dawn till dusk. Our whole environment is anti-sun. And so we're seeing a lot of vitamin D deficiency, and you can't eat it. They eat it, they get normal levels, but they're not changing this brain inflammatory disease.
How interesting.
Because I think it's the fundamental way we get vitamin D that's the sun's anti-inflammatory for us. Okay. But don't panic, because I've been in Australia, I had to go to the Cancer Council. Okay, help me out here. I have a message to give, but how do I give it? 10 minutes, forearm in the sun gets all the vitamin D you need a day.
Exactly. So there's actually no reason to kind of
compromise. No, because that will not give you, and why do I say
Exactly.
forearm? It doesn't have to be a forearm, but you can check your forearm, right? So I want little spots. What's that spot doing? And get it cut off early.
Totally.
So that's the advice. Do not expose your back.
Yeah, can't see that.
Can't see it.
Okay. Yeah. All right. Another one that was circulating on social media: all women should be on a keto diet at menopause for their brain health.
I would not do that.
Okay. What is the best diet for brain health?
Oh, well, okay. So, oh my goodness. So the best diet for brain health, the most studied diet for brain health is the Mediterranean diet.
Yes.
But the DASH diet, there's 1,000 diets out there that basically are good for you and have shown benefit, but they're less studied because they're not as popular as that diet. That's always studied, okay? Yeah. I had a PhD student who looked at this beautiful work where they took all the diets. We did diet scores for every woman because we have a full nutritional survey. Yeah. They scored them Mediterranean, DASH, they scored them for all the different diets based on exactly what they were eating. And long story short, I could show you the graph. Everyone's eating the same stuff. It's like they're all shopping at the same shopping center, except for a few exceptions. Okay. So when you look at this, you can see that the people who are getting ill are eating sugar.
Right.
And cakes and sweets, added sugar, and processed food, added sugar, added salt. Yeah.
Okay.
So stay away from adding sugar to your diet.
Okay.
Yeah?
That's a nice, simple one.
You can eat anything,
Yes.
just don't add sugar.
Okay, good.
Yeah, and cake's obviously a pure added sugar.
Absolutely.
So minimise that.
Uh-huh.
And processed food is a big one. People don't think of it as sugar. And it's literally sugar and salt in every processed food to be able to let it have a shelf life.
To make it be so palatable as well.
And then the people who are doing really well, they have big pings on fruit and veg, green leafy vegetables, nuts.
Yes. Okay. So
avoid that, eat that.
Really nothing special apart from the standard advice that we give people all the time for actually everything. So brain health, heart health, everything. Tell me your kind of, if you've got a woman out there who's going, right, I'm really interested in this conversation. I'm worried about my own risk. Maybe my mother had dementia and I watched her go through what she went through and it was awful. I really want to save that fate for myself. What's the number one thing you want her to do?
Oh, the activity. Everyday activity and keep using your brain. People are like, oh my God, do I have to do crosswords? No, unless you want to be good at crosswords. They did all these brain training where they made them do crosswords, they made them do Sudoku. They got damn good, these demented patients doing Sudoku, you know. But it doesn't change your risk of dementia, interestingly. But you know what does? Using all of your brain.
Yeah.
So people forget when they do Sudoku, they're only using visual and verbal and socialization. We use balance, we use movement, we use recognition, memory. Like we're actually using the largest parts of our brain when we interact with others because we have to get up and go somewhere too most of the time.
Yeah.
So that's probably the best thing to do that's an overall.
Yeah.
And if you can discuss current affairs except for Trump, then you're doing even better because you're actually intellectually also exercising that brain.
So stay social and exercise.
Yep. And the other thing I got to say is in 2000, the National Institute of Health mandated that females are included in all clinical trials, made a mandate. You can't register your trial if you don't show you've got half women.
Hallelujah.
Yeah, so 2000, they did it. However, they're not giving their results by sex.
Right.
However, when we started working out heart disease was different and dementia is probably going to be different too and clearly different because 2/3, people went back to the data set and said, well, can I have the data?
Yes.
And they've certainly recorded, and sorry about this, it's only binary gender, right? So that's what we're with. It's male, female, which means there's going to be some XX and all the rest of it. That's all we got. So looking male versus female, we have seen a massive exponential rise in reports of sex differences.
Wow.
It's doubled just in the last 10 years.
That's so good.
So we have so much knowledge I could give you today on how you would treat dialysis, how you dialyse a woman versus like dialysing a man. I can tell you it's out there. They're putting it out there. However,
Cassandra, you need to write another book.
Doctors don't read books.
No, I do. You need to write another one.
What we need to do and what I've actually done, and it's launching in July, is a sex-specific health education course.
Love it.
It covers why we would do it. It covers, there's 4 units that will then give an accreditation that you're sex-specific. This is the doctor you want to go see, right? Yeah. And I want to offer it not just to doctors, to all allied health, of course, because the muscles, so I'm doing biology, structure. You know how actually the Olympics just stole my thunder with their recent, the muscles are different.
Yes.
And pharmacology, toxicology. Women have 4 times the rate of adverse drug reactions. And you'd think this is only information for doctors. Pharmacists, pharmacy students, patients, everyone needs to know this. We need to upskill. The knowledge is literally there. But no one pays for education. No one let's do it. Hang on. 10 million you'll give me for this trial, right? But would you give $1 for me to tell everyone what's out there that could literally overnight, the lowest hanging fruit is women's health.
Oh, health literacy in women's health is the lowest hanging fruit. That's why I do this podcast. It really is. It really is.
And we've got to give the knowledge to women too, because they're their best advocates.
Well, the thing is, if you don't know that something could be wrong, it's actually pointless educating us. If the woman doesn't know to come in and see us, what's the point? You know, they have to be educated. Absolutely. I completely agree. I have loved speaking to you. I wish that we could have had much longer.
Sorry, I got so rushed.
Not at all, but I'm just so grateful for you to come in. So thank you very, very much.
My pleasure.
And that's it from us at Women's Handbook Podcast.
The content of this podcast is for educational purposes only. It is not intended to replace the doctor-patient relationship, nor does it constitute personalised medical advice. If you are affected by any of the topics discussed, please speak to your doctor or a qualified healthcare professional.